Auzubillahiminash-shaitanir-rajim. Bismillahir-rahmanir-rahim. So first of all, we will tell about upper limb, how to start upper limb and how to read and how to memorize everything of the upper limb. Okay, so in this first topic, we will tell all about how to read and how to understand everything about upper limb. Okay, so all of this, many of the students just start. Sometimes they start lectures, sometimes they use books, but they don't understand how what is important, what is not important. Sometimes they just waste their time on the insertion and etc. Okay, and they miss the important thing of the upper limb, which is important also for the examination, also for the vivas, etc. Okay, because you if you read in medical anything, you have to understand it what thing is important. Okay, what thing we have, medical field is a lot of subject, a lot of things, but you have to understand that what is important for me. Okay, for example, this is upper limb, just one thing, upper limb, it is called upper limb. Okay, so what is this, what is it? Is simple thing. Okay, but sometimes you just waste your time on this, waste your time on this, but you have to understand what is the common thing and what is the important thing that that it will help me when I move ahead to the medical field, and it will help me a lot. Okay, that I focused on the single thing. Okay, so I will tell everything that what is important and what is not, and we will complete the whole upper limb. Okay, so you have to watch all the complete video, and just everything will be easy for you. Okay, and I will use Gray's book in this lecture, Gray's book and the Adil Banduk slide. You can watch, if you understand the Adil Banduk language, you can watch his lectures on YouTube. Okay, mm, this is his slide. Okay, and this is the Gray's book, but mostly we will use the Gray's book. And now I, for example, said at upper limb. So what is important in upper limb? You have to understand upper limb. You, if you start upper limb and lower limb, okay, you have to ask from yourself different thing. Ask from yourself time, that how much time that you have, how much time that you are giving to this. Okay, so when you find your time that you have 2 month, 1 month or 3 month, just divide your time, that I will cover uh, half. For example, if you have 2 months, you have to complete upper limb in 1 month and lower limb in 1 month. Okay, if you have 1 month, in 15 day upper limb, 15 day lower limb. Okay, so just like this, you have to divide your time. After dividing your time, if for example, if you are watching my channel, just watch this lecture, and after watching this lecture, you have to use your uh, app. In this video, I also provide you use Gray's book Adil Banduk slide, because Adil Banduk slide, if you watch the Adil Banduk's books video, it give you a comprehensive, just like a topic, that this is the topic and here is present this, just like notes. Okay, and the Adil Banduk slide just like a note when you are in the class 10, 12, 11th, you using notes, just like Adil Banduk slide is just like a notes. Okay, and Gray's book is just like a comprehensive book for you, Gray's book. And the second thing is I will use app. Why? App is very important because it's create your imagination, everything about imagination, that how 3 dimension, it give you a detailed information about the 3D, that how this bone is present, that what is present to the lateral side, the medial side. Okay, and the medial side, lateral side, what is lateral side, medial side? If you don't know about this lateral side, medial side, proximal side, okay, head, these all is called medical terminology, and this terminology is important for you to understand. Okay, I will tell many of them in the lecture, during lecture. So in upper limb, you have to understand, for example, one is the osteology. Osteology, the complete upper limb and the body contains bones, so you have to understand the complete bones. After understanding the bones, you have to understand the muscles. If you understand the muscle, their function, not every one function, just like flexor and extensor. Okay, I will tell all about muscle and nerves. What is nerves and which nerves are doing? For example, nerves supply to the muscles. When the stimulus come through the nerves, they stimulate the muscle, and the muscle contract and relax, and this create, for example, this is your hand, and a signal come through the nerve. They stimulate the muscle, and the muscle contract, and you up your hand. So this up and down, everything is depend on your nerve. If your nerve damage, you can't work, your muscle just become denatured and lost their function and lost everything in. Okay, so first of all, you have to bone. Why in bones? For example, this is a bone. Bone is not just support. Bone have insertion. For example, the muscle attached to this bone and move to the other bone. So bone give attachment to the muscle and also provide a structure. Okay, so bone is mostly the bone give a attachment to the muscle and increase the mobility. The second thing is the muscle. For example, this is the bone. So the movement of bone, who do this action doing by the muscles. Okay, and the third thing is the nerve. The nerve stimulate the muscle uh, contract, and after contracting, the bone move up and down, flex and extension. Okay, so this is the nerve. The second thing is the arteries and vein, and then lymphatics. But you have to understand the most important thing is the nerves here. You never miss any nerve. Okay, and the muscle, these two are mostly so important in every aspect. You have to just give your time to bone, muscle, nerve, artery, veins. Okay, now if you see that in upper limb there is little bones, you can understand easily, but you have to give your time that how the for example, first you say the bones. Okay, ulna, radius, ulna, then after going that how muscle is attached to each bone. Okay, after muscle you have to then that how the nerve moves along the bone. This is the bone, how nerve moves. This is the muscle, how nerve move along the muscles. Okay, and the arteries, you have to understand how artery moves along the muscle, along the bones. So you have to find the dimension that how this thing is moving. Okay, because during surgery, etc., you for example, you doing surgery, you have to know, if I cut this thing, if I cut this area, what things are damaged, because you have already understand that this area contain this muscle, this artery. If I damage this area, then this thing will happen. For example, if you damage this area and you know that here is this nerve present, if this nerve dysfunction, the muscle don't work, and the muscle don't work, so many of action disturb of the persons. Okay, now this is the simple scenario of upper limb. So you can start from this. First of all, you have to you can find bones lecture, then muscle, then nerve, then artery, then vein. So your complete osteology of upper limb become complete things of upper limbs will be covered. Okay, easily. So now let's come to the point that here is the introduction. For example, this is your shoulder, the joint, and this area is called shoulder, and this joint is called glenohumeral joint, because this is glenohumeral cavity, and this is the humerus, and this is the glenohumeral joint. This is called glenohumeral joint. Now after, this is the glenohumeral joint, this is the neck, this is the neck of the person, this is the shoulder, and below the shoulder this is the arm. From this area to this is called arm, and this is the humerus. Okay, arm is the complete structure. It contains humerus, muscles, nerve, artery, all things. And this is the elbow joint. One joint is called glenohumeral joint. The second is the elbow joint, and here this is the arm, this is the forearm, and this is the hand. Simple. Okay, so we start from the simple and move ahead to advanced. Okay, this is the forearm, this is the hand. Now you have to understand these things. Now this is the rest joint. Third is the rest joint. Joint mean glenohumeral joint, elbow joint, and rest joint. Three joints are present in the upper limb. Okay, there is also joint. This is called. This is the now come to the bones. This is the humerus bone. This is the radius bone. This is the ulna. Why radius? This is called radius bone. This is called ulna. Now ulna. This is the head. This is the head of the. This is the head of the radius. This is the head of the radius. Okay. Now the head of the ulna. Now move ahead. This is the carpal bone. These all are the carpal bone. This is the metacarpal bone, and these are the phalanges. These are phalanges. So I have discussed the bone. Now we'll move ahead. This is just simple introduction. Now just functioning, functioning of positioning hand. Now just see, this is the axilla. This is the most important thing you have to understand. What is axilla? Because many of surgeries are happening also here, and this is the important region. This is the cubital fossa. You have no the cubital fossa here. You blood pressure. You check the blood pressure here because there are many arteries move ahead, and this is the carpal tunnel because this carpal tunnel move below this carpal tunnel there is move a nerve, artery, etc. Okay, and muscles. If this carpal tunnel damage, they damage the nerves. Okay, and after the damaging nerve, the functioning of the hand disturbs. Now this is happening. Now just see the abduction, adduction. What is called abduction and adduction? Just see that abduction, adduction. This is abduction, ABD. Okay, and this is A double D, add. So adduction mean add. You are adding something, and abduction mean you are subtracting something. You are moving away. Add mean to add something. So that is called if you move your head to the center of the body to the axial side. For example, this is the axial skeleton. Okay, and you are moving to axial side. This is called adduction. If you are moving away from the axial side, this is called abduction. Now retraction and protraction. Retraction and protraction. For example, if you moving along this side, your head, your hand to this side, this is called your head, and this is the bones of your glenohumeral joints. This is the humerus, this is the clavicle, this is the scapula. If you move your shoulder back, this is called retraction. If you move toward ahead, this is called protraction. Now this is just flexion. If you, for example, this is your hand, if you move the hand up, this is called flexion. If you move this joint, for example, this is the joint of your hand, and you move up, this is up. Okay, from this side to up, so this is called flexion. And if you move your hand back along this joint, so this is called extension. Now adduction, just see abduction, the hand is moved away from the axial line, and this is called adduction. The hand is moved toward the axial side. This is called adduction. Now circumduction. What is called circumduction? For example, you are doing all abduction, adduction, abduction, flexion, extension. You are moving all the three, all the four dimensions of the thing, that is called circumduction. But if you see the circumduction here in the here is not present, just looking like, okay, there is not explaining. Now this is the flexion. If you say this is the joint, okay, now you are moving the hand along this side. For example, this is your hand, and if you move around the elbow joint, so this is called flexion. If you move the complete hand along this side, for example, this is your glenohumeral joint, this is your elbow joint, this is your elbow joint. Now you move complete hand to the up, so this is also called flexion. This is flexion of the elbow joint, extension of the elbow joint. Okay, but if from this side, if you move to the back, complete hand, this is called extension. Now this is the radius bone to the thumb. To the thumb sign is the radius bone, and to the little finger is present the ulna bone. Now, if you protraction and supination, supine and pronation. If if you place your hand on your chair, on your table, this is just like this. If you are for example, if you go to the bed and just move to the move to the floor, upper floor, okay, and you sleep like this, you are sleep like this, so that's why it is sleep. It's s. So s and supine, sleep and supine is same, mean that we are sleeping, that our hand is sleeping. And protraction, what is the protraction? In the in the pronation, for example, in protraction change you change, for example, how you your eyes nose go toward bad side, you see nothing, so that is called pronation. So this is the pronation, palm of the posterior. If the posterior side come, but you have to rotate your hand, this is called pronation. And the arm, the palm, if the palm come up, okay, so that is called supination, because this is derived from the sleep. During sleep, you this, for example, you have to just understand that this palm is your eye, nose and mouth. Okay, if these are seeing to the upside, this is called supination. During sleep, if you move, if you sleep like this, that you see your upper floor, okay, and this is the pronation. Now this is just simple introduction. Now see this abduction, adduction. What is abduction? For example, now in the hand, for example, this is your hand, so in the hand you have don't know that where is the axial skeleton, but you have to hear that, understand that this is your hand, this is the your hand, okay. And if you see the your hand, if moving to the this side, this is called abduction, okay. Just go to this supine palm supine position, this is the supine position of your arm. And anatomical position, or you know anatomical position, what is the anatomical position? Anatomical position, if you stand, if you stand and seeing to me, okay, and seeing, this is the, now this is your hand, this is this is your hand. If the hand and the palm, this is the palm, no, so the palm have eye, nose and mouth, okay. If your palm, eye, nose and palm are to the front side, okay, so this is the anatomical position. So you can see that the little finger, the little finger is toward the axial side and the thumb is toward lateral side. One is the medial side and what is the lateral side? Why it is called one is the medial side? Medial side are those side which are near to the axial side, and the lateral side are those which are away from the medial side, from the axial. So this is called, for example, this I just uh, enlarge this space, this is your thumb and this is your fingers. 1 2, the diagram is not a bit much beautiful, just understanding from this diagram, okay. Now see that this little finger is toward the medial side and this thumb is toward the lateral side. If you move your hand toward lateral side, then this is called abduction. If you move your hand toward little finger, this is called adduction. Okay, now extension and flexion. For example, if you move your head to the palm, if through the palm to the palm side, that is called flexion. If you move to the dorsal side, this is your dorsal side. This is the dorsal side, that nothing is present here, just only hairs are present. Here is no hair. Okay, so that's why this is called dorsal side. If you move your hand to the dorsal side through wrist joint, this is called extension. Now if you do all the flexion, extension, adduction, abduction, this is called circumduction. Now we are going to the component part have bones and joint. One I have seen that this is the bone and the joint. Okay, and the second thing is the bone and joint. If you understand bone and joint, after that you have to understand the muscles, that what muscle are present here. So now come to the bones. I have already discussed. This is the clavicle bone. This small bone is called clavicle bone. That ossification I have first done. The behind this, here is a scapula. I will show. Let's see to the app. Okay, now just I will see everything in the app to you. This is the app. Now just going to the upper limb. Okay, if you see, just rotate this. There is all muscle are present, but just remove axilla and what other things. I am move to the back side axilla. Okay, now see, this is your chest, humerus, everything are seeing. This is the muscle. I remove all the muscle and show the bones. Okay, I will tell everything like this. Just see, I am seeing you a bones. Okay, now we are in the bones osteology. This is the clavicle. Okay, if you see from all side, you have to see all side. For this purpose, you have to go to your college, and in the college you have to go to your lab where are the skeleton present, so you can easily see this skeleton. Okay, now I am just, this is the scapula. Okay, from all side you can see this. This is just like, I will see from outside to you, that you can easily palpate everything around this is present. This is the scapula. These are scapula. This is the scapula bone. Okay. Now if you, this is the scapula. I am removing this is the humerus bone. I have removed this bone. This is the scapula. Is I am hiding all other thing to see you scapula. This is the scapula. Just see from all side. Okay. This is the scapula. Now you understand about the scapula of the bone. Scapula bone. We will tell about in the Adil Banduk slide, that what is present, what is the ridges, what muscle attached to this. But you have to, the imagination power of you is increased, that you can easily know from all aspect. Okay, now it's have done. Now just see, this is the scapula and this is the humerus, and between this there is a capsule. This capsule is present between these two bones, and that provides support to a joint that is called glenohumeral joint. Okay, you have see all things from this side. Now this is the humerus. Just see the humerus. These all are wires are present. What is this wire? This wire we will discuss everything in the detail. There is a nerve. This is a nerve. Which nerve? This is a radial nerve. Okay, to lateral side. Now just move back to the, just move back to the slide, etc. Now in bones we have see the clavicle, okay, and you see the clavicle have different parts. You have already seen in the clavicle. I am again showing to you that clavicle have how much part. Just if you move ahead, let's wait, okay. This is the acromion. In the clavicle there is acromion. There is a acromion, clavicle, okay. Scapula. This is the scapula. I have show you a scapula, okay. And this small bone is called clavicle. This is the glenoid cavity. This is the humerus. This is the ulna. This is the radius, carpal bone, metacarpal, phalanges, okay. Now move ahead. Muscle. Muscle have on the back side, if you see, this is the trapezius muscle. This is the latissimus dorsi. This is the important muscle, that's why this is present here. This is the clavicle, and the clavicle, this is the trapezius muscle. The trapezius muscle is attached to this area, and also in the front side also attached to the clavicle. This is the clavicle bone. Clavicle bone is present to both sides, okay. Now trapezius muscle, this is the latissimus dorsi muscle. This is the levator scapula. This is the rhomboid minor. This is rhomboid major, and this is the deltoid muscle. Deltoid, I will show this in the image, in the app, okay. This is the pectoralis major. Why? This is the pectoral mean chest side, and this is present to your chest side. This is called pectoral major, and there is a pectoralis major below this. If you remove this pectoral major, you will see the pectoralis minor muscle, and this is the teres minor muscle. Teres minor are present, not seeing completely here, and here is the latissimus dorsi. This is the latissimus dorsi, and here also present teres major and teres minor muscle. Now just go to this side. This is the supraspinatus, infraspinatus, teres minor, and teres major is also present, but here is not showing. Spine of the scapula. This is the spine of the scapula. This is the, if the spine of the scapula move and become enlarged, this is called acromion, and the coracoid process. And to the front side of the scapula there is present a coracoid process, okay. Now we will see these all thing in the app. Relationship to the other region. After this we will see the relationship to other region, for example to the neck. This is the neck, okay. And neck, the from the brain the nerves, and from the brain nerves are coming, and from the heart arteries are coming, and from the hand the veins are going, okay. So this create a space, and this is the innervation. This is the relation with the neck and the arm, okay. So you will see superior thoracic aperture axillary inlet. There is present axillary inlet. Behind, in the inferior side there is axillary inlet. This is the axilla, okay, and there is axillary inlet, and this is the superior thoracic aperture, that everything enter to the thoracic. Now if you see the, this is the medial side. What is called medial side? These all are the medial side, and these are all the lateral side, okay. This is the lateral side, so that is called lateral side. In the arm, arm, for if you have arm, okay, and this arm have one thing in the front side. This is the front side now, so this is called flexor muscle. All muscle are present here is the flexor muscle, and behind and to the back side, all the muscle present to the back side is called extensor muscle. So you have to understand this thing, in that the uh, extensor muscle and the flexor muscle. This is the flexor muscle and behind this is called extensor muscle. Now humerus, this is the humerus bone. If you cut this area, you see this is the front side, this is the back side, and in between these present a humerus bone. If you cut this area, okay, you will see this is the humerus bone, this is the flexor side and upper side, front side, and this is called flexor muscle. So there is muscles present and their muscle is called flexor muscle, and anterior side, flexor side, and front. Okay, now posterior side, if you see to the back of your hand, that is called posterior side, and all the muscle present here is called extensor muscle. And between there is this, these are two muscle, this is one muscle, these are two muscle, two compartment. Okay, anterior and posterior. Between these two compartment, one is the humerus present, and the other thing is the intramuscular septum. The other thing is the intramuscular septum. This is the intramuscular septum. This septum separate these two things, these two compartments from each other. Now, so here are in the hand, in the arm. This is the arm, this is the forearm, this is the hand. In the arm, you have anterior compartment and posterior compartment and muscles. Now, if you cut this area, if you cut the forearm in the middle, if you cut the forearm in the middle, cut forearm in the middle, you will see anterior flexor muscle and posterior extensor muscle. Okay, and this is the ulna, this is the radius, and this is the deep fascia. Deep fascia, why it is called fascia? Deep fascia separates muscle from each other, muscle and compartment from each other. So this is the ulna bone. Ulna bone is to the medial side. Okay, to the medial side, this side, to this side, to the medial side. What is called medial side? This is the medial side. Okay, this is the medial side, and radius is to the lateral side, okay. So between these two bones have an interosseous membrane is present. Between these two bones have an interosseous membrane present. Now back and thoracic wall. Now this is, if you see the shading, this is just like, if you see like this is a plastic bags something, this is called, in this color, these all things are present, this is called axilla. Okay, axilla is color like this. Okay, and these axilla are showing to you that in between, in axilla have vein, arteries, and nerves. Okay, and I have a format, I have don't tell to you that in nerve, what is nerve? The nerves come from the brain through the spinal cord, and this, and there is our complete nerve come out from this area and move toward head, and there is a complete nerve just connection with each other, and this connection, after ending this connection, have different nerve come from this connection, and this is called brachial plexus. This complete connection is called brachial plexus, and from the brachial plexus different nerves come out, and different nerve have different supply to different muscle. Okay, so you have to understand about the brachial plexus. I will explain what is the brachial plexus, okay, in simple manner. Now you have just moved the humerus, this is the humerus bone. Now this is the, I have tell to you that the scapula are present behind, and this scapula have two processes. one is the acromion process, and one is the coracoid process. This is the coracoid process. Okay, now just we will go to the app, just completing these key points. Okay, I have trapezius muscle, levator, scapula, rhomboid minor, rhomboid major, latissimus dorsi, and auxiliary process pectoralis major muscle. Now just move ahead. This is the brachial plexus, nerves, musculocutaneous nerve C5 to C7. I will explain. If the nerves move out along this area, this is called C5, cervical vertebra. Okay, from this region, that's why it is called C5. C6, this is derived from this area, this is called C6. If from this area nerve innervate, this is called C7, and from this area innervate, this is called C8, and from T1, this is called T1. So these are the roots. Okay, actually these are the roots, and from the roots different nerve originates. Okay, for example, musculocutaneous nerve is this nerve. Okay, this is the musculocutaneous nerve, and this is the musculocutaneous nerve, this is the medial nerve, and this is the ulnar nerve. The musculocutaneous nerve is supplying here is the anterior muscle of the arm. So they supply the muscle of the arm. After medial nerve move toward the arm and to supply to the flexor compartment of the arm. And you see that this large nerve that move behind the humerus, that is called radial nerve, and radial nerve supply to all posterior muscle, to complete posterior muscle of the complete posterior muscle, that is the posterior muscle. Now if you see the C5 C7, so musculocutaneous have a nerve root C5 to C7, C5 to C7, and the medial nerve has C6 to C8 and T1, C6, C8 and T1, C6, C7, C8, T1. No, and radial nerve C5 to C8 and T1. Radial nerve have all supply from the all root, and ulnar nerve have C7. Ulnar nerve derived from C7, C8, T1. Okay. Now move ahead. I will show the app to you now. Just wait. Now this is the app. In the app you see all muscle, and I will show the muscle and different things. For example, I have seen this is the pectoralis major muscle. You can see this, and there is the important thing that between this pectoralis major and deltoid, if I have see that this is deltoid, why this is a deltoid muscle, these three compartment, these are the three part of the deltoid, these are the complete deltoid muscle. Okay, most of the injection are injected through the deltoid. Okay, so this is the deltoid muscle. I will select multi select. Okay, now I have selected the deltoid muscle. This is the deltoid muscle. Just see, now I am removing the deltoid. If you remove the deltoid, this is present, this area will show to you. Now deltoid have become gone. Okay, now this is the supraspinatus, this is the spinous of the scapula, this is the scapula. Okay, scapula bone, and this is the spine. So if above this are present the supraspinatus, and below the spine have present infraspinatus muscle, and below the infraspinatus muscle there is a teres minor muscle, and below this a teres major muscle. Okay, teres major muscle and teres minor. Why? Because these both are right from the same regions. Okay, and they move more side, and that is called teres. They move, and this is called teres minor. This is the teres major muscle, and this is the teres minor. So just revise: supraspinatus, infraspinatus, and teres minor. Teres minor, and the one muscle is here is present, the teres minor, and this is the subscapularis muscle. The subscapularis muscle are not showing, but I will show. Okay, fed on. I am deselect all, remove the pectoralis major. This is the deltoid muscle. Okay, and in that after deltoid, supraspinatus, infraspinatus, teres minor, and the subscapularis muscle. I will show the subscapularis muscle completely. But these four are muscle are attached to the humerus, just like a circle. Okay, and these four are called rotator cuff muscle. Why? This is called rotator cuff muscle. What is the rotator cuff muscle? Rotator cuff. If someone asks from you rotator cuff muscle, so you have to remember the mnemonics: si, small t, and s. Supraspinatus, infraspinatus, and small t mean teres minor because it is small t, so that's why teres minor, and s subscapularis muscle. Just I have not show. Okay, sorry, the app there is a. Now this is rotator cuff muscle have SITS. So first S mean supraspinatus, and I mean infraspinatus, T mean teres minor, and because T is small, teres minor, and S means subscapularis muscle. So these are called sub rotator cuff muscle, and rotator cuff muscle. Now I have also shown that thing in the app. Okay. Now go to the app and just see to you that easily you can see the supraspinatus, infraspinatus, teres minor. This is the teres minor. Okay, and teres minor have. Now I will show the subscapularis muscle. Where is the subscapularis muscle? Okay, deselect all. Now I remove everything from here. Okay, let's wait for a second. I will remove everything from here, and you can see the everything. Okay, I remove all other muscle and all other bones from this side. Sorry. Oh shit. Show all. I again showing to all. I show this all muscle. Now from the back side. Okay, I will remove all muscle from the back side, so it will become easy. This is the subscapularis muscle. Okay. Now see, this is the subscapularis muscle, and this subscapularis muscle attached to the scapula. This is the scapula. Okay, I just hide others. If you see, this is the. Okay, very good. You see, this is the scapula bone. This is the scapula bone, and the scapula bone have attached this muscle. That is subscapularis muscle. And now this is to the anterior side, and this scapula is attached to the thoracic thoracic. Okay, you have ribs, etc. All that things are present, but between these there is a present a subscapularis muscle. These all rotator cuff muscle cover the scapula, cover the scapula. This is the teres supraspinatus. Here is infraspinatus and teres minor. Okay, so these are bone subscapularis muscle. We will we will see that thing. I will just wait. Okay, infraspinatus, infraspinatus muscle. I have that. Okay, sorry. So now you have see everything there: supraspinatus, infraspinatus, teres minor, and subscapularis. Remove the deltoid. Supraspinatus, infraspinatus, teres minor, and the other thing is the subscapularis. These four muscles are called rotator cuff muscle. Okay, so it's easy muscles. Now rotator cuff muscle have gone. Now you have a musculocutaneous nerve. Musculocutaneous nerve is supplying to the anterior side of the arm, and the other nerve is the median nerve. Median nerve are doing what are doing? Median nerve move to through this side and go above the medial epicondyle. This is the medial epicondyle, and to the and supply to the forearm muscle. Forearm muscle. Forearm muscle to the anterior forearm muscle, and the ulnar nerve. This is the ulnar nerve. Ulnar nerve move behind and then move to the hand, and they are supplied to the hands muscle. Okay, mostly. Now the anterior side is called an axillary nerve. This is the radial. This area is supplied by radial nerve. Muscular. This area is supplied by. You have understand about nerves. Nerves have two innervation. One is to the muscles. One is to the muscle, and the other is to muscle. Okay, and the other is to the skin side. So this skin is supplied by the axillary nerve, and this skin is supplied by the radial nerve, and this skin is supplied by musculocutaneous nerve. This skin is supplied by radial nerve. This skin is supplied by median nerve, and this is by radial nerve. Okay, so we are distracting from we have about first bone, then muscle, then nerve, then artery. And nerve in the upper limb, the nerve, all upper limb nerve are derived from the brachial plexus. Brachial plexus. Okay, and we tell about what is the brachial plexus. We will tell about this. Okay, so now go to the Adil Banduk slide. So first of all, upper limbs bone. Part of bone: shoulder bone, arm, forearm, hand. In the shoulder, there are two bones present. One is the clavicle. I have shown this clavicle in the app and in the Grace book, everything. And the other thing is the scapula. I have already shown the scapula. Now, the in the arm have only one bone, that is the humerus. Okay, and the forearm have two bones. One is the radius and the other is the ulna. Radius is toward lateral side. Okay, toward the thumb side, and ulna is toward the little finger. Okay, that is the ulna. Now the hand have how many bone? Carpal bone, metacarpal bone, phalanges. These small bone are called carpal bone. I have gone to the app. Sorry, very sorry. I have not. Now sorry for that. I have not discussed the seat you the app.